Thank you very much for the invitation and for the great presentations. So my presentation will complement what we've heard so far yesterday and today. I'm a food engineer by background, and I've shifted to public health, and I work in public health. I work for INSERM and at the French School of Public Health, and I'm also a research fellow at Trinity College in a business school in Ireland. So I have no conflict of interest. My research is funded by public money, and this is also not only my work, but that of my colleagues, so I want to acknowledge all of the colleagues who have contributed to this body of work. So my presentation will be about what we call in public health and in medicine the commercial determinants of health. So last year we've published a series of 3 publications in the Lancet, which is one of the most prestigious medical journals. And I'll describe what are the commercial determinants of health, but just to say that it's not an isolated conversation by a few of us in public health who make the relationship between corporations and health and study that. But it's actually one of the most important messages that we have in public health. One that we've also published a book. I had a chapter in that Oxford Handbook on the commercial determinants of health, also published last year. There will be a report published by the World Health Organization next year, and one also at the European level. So it's a growing conversation which summarizes basically what we've heard up to today, and this is about population health and planetary health as well, and we made it clear in our Lancet series. So the definition, we had 3 publications, and I will basically summarize what we've said in that series because it's really a big summary of what we know about the topic up to now. So the first publication is about the definition and the conceptualization. What are the commercial determinants of health? So we've defined them as the systems, the practices and pathways through which commercial actors drive health and equity. So we kept the definition neutral. Most of us studied the negative influence of those corporations on our health and planet, but there is some space for also positive impact on our health. Like I eat some processed food, like oil, for example. Olive oil is processed, is in a bottle. I don't go and pick my olives and do my oil. So there is a space for some commercial activities in our lives, so we keep that open. What we've shown is that 4 industries, cigarettes, food, fossil fuels, and alcohol, are responsible for 1/3 of all global deaths. Just those 4, and there are many other industries, of course. So it's an urgent problem to tackle, that we have to tackle in public health. So this is the complex model that we developed. I won't go into the details of it, but what we were saying is that so far in medicine and in public health, we focus on the center of that half circle, so the yellow part of it. We focus a lot on individuals. So eat your 5 fruits and vegetables a day, move more, or stop smoking cigarettes, control your intake of alcohol, etc. That's the messages that we have in public health. They are very much focused on individuals as responsible for their own health. The green part of it, a lot of us in public health understand it as well. It's the environment in which we live. So we understand that not everyone can make those healthy choices. Not everyone has access to healthy food. If you go to, for example, the Bobigny campus of La Sorbonne, you won't find any healthy food around, like you would have just fast foods. So for a student in that campus, for example, it's different than to be in Paris. So sometimes the choices that, and I talk a lot about food because that's, I'm a food engineer, but there are also, I work on other industries as well. So the choices that you make are very much shaped by your environment, and we know that. What we've also discussed in the Lancet series, and which is perhaps of utmost importance for that discussion, is the blue part of that model, the political and economic system that allows for those environments to shape our behavior. our behavior, sorry. So the financialization of the food system, for example, if we talk about it, trade and investment, liberalization, privatization, all of those things. We have all of the evidence from a public health perspective that all of those things are contributing to our bad health. Yet we don't focus much, almost not at all, on that system when it comes to public health interventions to try and make people healthier. So there is that half circle about our system in which we live and how ultimately the blue part of it is shaping how people consume and how people behave and makes them sick. What we've also studied is the circle on the left-hand side, and that's where most of us do our research. We focus on commercial actors that are as part of that system, and there are different practices. So my specific expertise is on the corporate political activity that was discussed previously. But beyond that, we also say, so the corporations have products that make us sick, so the cigarette or alcohol, the thing that ultimately you consume as a citizen. So they have the product, they have those practices. It could be corporate political activity, marketing practices, but also the way that they treat their employees. So labor practices, that also impacts your health if you're on the supply chain, or for example, if you take, if I take Nestle, for example, as a company, not to name one, but so they have some unhealthy product. Themselves, they said that 60% of their products are unhealthy, based on their own standards, which are not the best ones. But so imagine if we were really independently assessing that. So 60% of their products are not healthy. They use aggressive marketing practices to push for us to consume those products. We know that. There is a lot of research on that. My research and that of others also shows that Nestle use ILSI, for example, as a way to influence our politicians and science, and multiple other platforms. But also they have employees that are not well paid, or like child slavery that they still use in cocoa plantations. So from a public health perspective, that understanding all of those practices is extremely important, because we tend, for example, to invite Nestle to the UN, so World Health Organization, because Nestle has decreased the sugar content of its product. It has reformulated its product. Everyone applauds the company for doing that, but then we forget about everything else that the company is still doing, and which is even more damaging to the population. So with that approach of the commercial determinants of health, we are saying, wait, it's much more broader than just the product or just the marketing. So what that's one of the infographics, and everything is accessible in our Lancet series, and I can share copies of it if you want by email with the organizers. What we've said, it's basically what has been presented before, is that commercial actors on the top, number one, they have a lot of power, of wealth, so they are able to shape regulation in their own interests. That in turns stimulate the increases of sales and of the consumption of their products. The arms is externalized, so the third point is externalized onto people and society, so we as citizens pay for those externalities. In France, for example, we have the French national security, health security, so we pay for that as citizens. It's not the corporations who pay for the damages that they have on our health. And the four is that, so the externalities are paid for by our institutions, which five means that corporations can continue increasing their sales no matter what they are doing to our health and our planet. In that publication, we also described some upstream drivers that I've already discussed and have been discussed before. So capitalism and neoliberalism as pushed for by corporations as the perfect system, while they never talk about those externalities, or not, they don't internalize the prices of those externalities. We are also made to believe that the economy is the ultimate goal for everyone, to increase our economy, and sorry, I'm talking to economists, but from a public health perspective, that's not, that's not obvious that, there is an alternative. So we are talking, for example, in public health of the well-being economy as perhaps one solution, and I don't even know if that's something good or not, but at least, prioritizing the health of people and of our planet above profits. And it's a choice that we make as citizens, as part of our democracies, and all of that is very much influenced by those corporations. So personal responsibility, yes, but as I said, sometimes you don't have a choice. So for example, our national nutrition program was pushing for people to eat better food, but we know that it increased inequities because those who could afford the less to have healthy diets, they couldn't follow the recommendations, and those who who are educated, have more money, then they could follow the recommendations. So then the differences between those people increased with those type of focus on personal responsibility. You also have philanthrocapitalism in public health, which is an important debate with the Gates Foundation, for example, who funds a lot of activities, notably at the World Health Organizations, but in other spaces as well. That's a lot of money, but that's not democratic and not democratically distributed for health and public health programs. And that's just a few examples of those issues. In the second publication, we discussed the commercial actors and their practices. So I won't, again, I won't go into the details of what we've done, and I've quickly shared an example with Nestlé, just to say that not all commercial actors are the same. Of course, it's not just also about transnationals. Sometimes, like I lived in Colombia, and I've done research in Colombia, some of the most powerful actors were, of course, they were multinational companies, transnational companies, but some of the national companies were just replicating the same model as the big ones from abroad, because we live in a neoliberal and capitalist system, so the companies are pushed to behave in that way. So it wasn't really a matter of if you were a national or an international company. They were all using more or less the same political influence and the same practices. As part of that second publication, we've just listed, I think it was 70 different criteria for someone working in public health. If you want to study a company and understand the impact that it has on our health, then you would have all of those 70 criteria to take into account. The way that companies manage their reputation, their political influence, scientific influence, marketing, etc. It's a very long list. So as I said, those commercial actors, and I've made a few examples, I've put a few examples here. Those commercial actors have certain products, so that's on the left-hand side, sorry, are cigarettes, for example, that you find in the streets and pollute not only our health but our planet as well. There is the pharmaceutical industry and medical devices industry, which contribute to good health to some extent, but also to there are a lot of issues with that industry, notably pollution, plastic pollution from that medical industry. And on the far right is a picture that I took when I was actually in Colombia. It was far away from the rest of the country, not accessible by road. You had to take a boat or fly to go there, and everything was polluted. It was a remote community, but yet you could see the pollution of our planet there. I also so the tobacco industry is one of the examples the most often used in public health. And when I started working on the food industry, I was sure that I would find another industry to as a model to study the food industry then. And with the tobacco industry, we know a lot about what they've done because they were sued in the US. There was litigation against the tobacco industry because of all the things that they've done to the health of Americans. And as part of the litigation, internal documents, that was part of the sentence, they had to share internal documents with the court. And in those internal documents, you could see from the inside that, you know, those corporations in the tobacco industry we're going to lobby politicians, we're going to schools, we're using front groups. I mean, and the science also influenced on science. So everything was written from their own words. So it was easy for researchers to study that industry. For food, we didn't have much internal documents, but then we could see, you know, the same patterns, the same practices. And as I said, I'm a food engineer. When you are working for an industry, no matter you know, the training on the specific industry that you have, you can work in any other industry. My friends, they work for pharma and alcohol and others, because basically, you know, you are trained to sell a product or market a product or to work on the supply chain, but you can use your knowledge to any, it's the same chemicals that we, you know, just to make it simple, but that's, you know, that's basically it. Also, in the middle here, I have illustrated, so Chiquita is a big company who produces bananas. So bananas is, you know, it's healthy. If you think about it, it's a healthy product. Well, then you can think about the climate impact of transporting bananas to European countries or other countries. You know, it starts to be less healthy. But Chiquita is also a brand who pushes a lot for us to consume bananas as a normal, you know, normal product. So if you go, for example, to an organic supermarket in France, banana is one of the only exotic products that you have, because otherwise clients will not come to the supermarket. You have to sell bananas because almost every client wants bananas in their basket. So, and that's part of that. That's part of the practices of that industry, is to push for us to consume bananas. So in the Minions, the movie, if the Minions are consuming bananas, it's because Chiquitas has paid for it, for the movie to display Minions eating bananas. Another negative practice of Chiquita, and I probably don't know all of them. So they had workers trying to unionize in Colombia, and they had killed some of them. So, you know, with paramilitaries in Colombia. So that's what I'm trying also to say. You know, it's not just the product, is it healthy or not? Be careful when you're a public health professional, because beyond the healthiness of the product or not, there are other practices. And that's what we've tried to share with the Lancet series on commercial determinants of health. Here is another example to make the link also with climate change. So McDonald's is one of the strongest opponents against the packaging waste reductions, the legislation in Europe, of course, because they make so much waste from their restaurants. Infant formula is another industry that I study. So we know that the infant formula, I mean, breastfeeding is recommended from a public health perspective until at least 6 months of age for a baby, and then up to 2 years of age and more. The and more is important, with complementary feeding. But the industry, of course, is pushing against that, and Nestlé is one of the biggest players in that industry as well, just to name them again. So they have an exploitative marketing, and I'm not an expert on marketing, but on social media, for example, we were talking about the difficulty about identifying front groups. Now it's very, very difficult, because they will have you know, friendly sounding names, groups of moms on the internet, and you wouldn't be able to know if it's an industry behind that. A few months ago I googled in French, you know, feeding baby, and one of the first sites was like eat baby, or like it was something like very natural. The name of the website. All of the information seemed like natural, but then there was information about weaning, so stop breastfeeding your baby, and you know, things like that. That were, you know, I thought, oh, that's strange. The only way for me to know that it was the industry behind it was to look at the legal mentions at the bottom, and then there was an email address at ANIA, which is ANIA is our national trade associations for the food industry, but that's the only way to know that the website was funded by a trade association. So it's very, for a normal citizen, it's impossible to know where the industry is. It's impossible. The idea that, and I don't know if some of you, we could discuss that, but there have been discussions on having a database, perhaps, of those front groups for people just to click on a name, and you wouldn't have to search again, because a lot of people are interested in that. Even us in research, we would love to know, what are the front group of different industries without having to do all of the searches again, because some of us study certain industries. So it's immensely complicated for us to know who is and where is the industry. The environmental impacts of feeding with infant formula is also huge. It has been studied. So the environmental impact of 4 months exclusive feeding with infant formula is between 35% and 72% higher than that of 4 months exclusive breastfeeding, because of the packaging, the production of infant formula, etc. So the relationship between planetary health and population health is extremely important for us. In the third publication, what we said is that we need to address actually the global drivers, the political economic system. So a lot of people, even those working on the commercial determinants of health, so people working in marketing or on the CPA, tend to not talk much about those global drivers, but that's where we need to shift our discussion to. The political economy harms our planet and our health, yet they are profitable. The current system is profitable. So really, as public health professionals, we should question that. Is profitability what we aim for? And we should be clear about that. The problem also is that we have a capture of our solutions, and Jennifer talked about it yesterday. So the industry, and this morning as well, the industry will offer market-based solutions. So for example, alcohol is another industry that I work on. Now we have the 0% alcohol product, but we know that it's just a door of entry to alcohol for kids, for example, or people who don't tend to drink, sorry. Just 0% alcohol is also a soft drink, so it increases your consumption of sugar, where you could have had, water or something else instead. So the industry, when it finds a problem in public health, it will offer you a solution, but that keeps you in the market. They don't offer you a solution that makes you really any healthier. The medicalization of health is also a problem. So obesity, for example, I had that discussion. It's outrageous. The obesity issue is, of course, of importance, but the pharmaceutical industry is pushing for, increasing the numbers and saying, like, obesity prevention is a big thing. Like, we need to do a lot of things around it. All of those people are obese, but why are they talking so much about obesity prevention? Because if everyone is obese, then they have a big population to treat with their medicines. So that medicalization of everything, everything is an issue. Like, you don't sleep enough, that's an issue. We have a solution for it. It's a huge problem in public health. And then the personal responsibility in the narrative, I've talked about it already. So in terms of future directions, we wanted to finish the series of 3 publications with a positive discussion. We would like to envision a world where norms are shaped in the public interest, where the externalities are met by commercial actors, so they pay for those externalities and the harms that they are doing on our planet and our health. And because they pay for that, so the power is more balanced and redistributed between those different actors. So government, civil society organization, regulators, they exercise power appropriately, and power between private and public actors is ultimately more balanced. What we've also proposed is that state and international organizations, they can incentivize investments in business models that are better for health and sustainability. Civil society groups, so it's really through collective action that we will change. That's very, very clear. So we need to articulate a different vision and hold our commercial actors, but also our governments accountable. If we've mentioned that if academia doesn't have enough funding, of course, you will find another source of funding, and when an industry is there, it's not the fault of an early career researcher, a PhD student, to take money from the industry if there is no other source of money. So we need also to push for public funding of all of those different things that matter for us. So health, education, or sports, etc. Commercial actors, of course, ideally they must stand their opposition to public health regulation and respect and comply with the rules. Academia and researchers, we should use our evidence and raise our voice to make all of those topics more visible in the public sphere. Health actors also, they should break that hegemony of the biomedical model. So prevention is important, not just the treatment of your patient. You are a doctor, you basically just see people who are sick, but doctors also have a role to play in the system, by just being vocal about the need to eat healthily and to stop drinking alcohol or decrease the consumption, etc. And yeah, our message is that the question is not whether the world has the resources or will to take such actions, but whether humanity can survive if we fail to make this effort. Future directions, for researchers, it's just discussing. Basically, it's discussing what I've just been discussing. The issue is that we get intimidated. I had colleagues being kidnapped, I had colleagues receiving death threats, etc. When you do that, because in public health we are very much, it's a field which is very much around implementation, applicable, we have case studies, so you go and you talk about companies, you go to talk with NGOs, so you are in the field talking with those people who are impacted by corporations, and that's one of the issues, is that we receive threats and other forms of intimidations. Civil society needs to be noisy. There is a need to have more coalitions and also work with doctors, as I said. Future directions. So I used to live in Chile, which was one of the model for neoliberalism, unfortunately for the population, but I was there when the population, so I was there to study the lobbying and the corporate political activity of the food industry. Everyone told me no one will talk negatively about the system because we've all benefited from it. There is no union, we have no civil society organization, so I'm not sure you will you will find anyone to talk negatively about the industry. And then a month after I arrived, you had all of the catastrophe and the social movement and protests, and it was very clear. I was super surprised, and that's one of my biggest motivation. Having been in Chile when that happened, because it was very clear in the streets that people were calling the neoliberal system, capitalist system, as the problem and it was mostly from young people, because they could see that there was no more water in their rivers. They couldn't pay for their education. So the younger generation didn't and doesn't profit anymore from that system. And I think it was because of the metro. They increased the price of the ticket, and that it just started something. But they were very clear. In the streets, you had there were signs with the brands and saying that those brands are responsible for the issues that we have with our democracy. They were talking about colonization, talking about the rights of indigenous people, etc. And they are now changing their constitution. So even in the most neoliberal country, where there was absolutely no criticism of the system, no civil society organization, no citizen or consumer organizations, people still think about the system, and overnight, because it was overnight, they acted against it. And I talked with older people in their 60s, 70s, who said we are so proud because because of the dictatorship we couldn't really speak, and we are still afraid. But the younger generation, they didn't know, they don't have the same feeling about what happened before. So we are super proud that they raised their voice against that system. And then people, it was a very fruitful research after all, because I had a lot of people discussing specifically the food industry, but they discussed also the neoliberal system and capitalist system as part of my research as well. Thank you.
Thank you again for a great presentation. Some questions in the audience? So it seems after your experience that reactions and concerns about public health are maybe more vocal in a country such as Chile than in European and in developed countries?
Absolutely. So but after what happened, people were much more free to speak about all of those issues. So not just not just food or health, but the environment, which was a big thing, and most companies, even in the food industry, they focus on the environment more than health. But yeah, absolutely. So that's also what drives me, because even when you don't see it as at the population level or in the media or anything, people still, it's still something important. So I think the collective action it was what drove the change in the population, because it was overnight. Everyone took the street and discussed, and that was very, very nice to see.
Yes. Well, actually, I am Chilean.
Okay.
And actually, I would disagree with you about it. For example, when it comes to pesticide use, I have been doing research about that. And there is a huge amount of pesticide being used in Chilean agriculture, because Chile exports so much food. Yeah. And we try to raise attention about it, because people don't know about it. Yeah. But regardless, it wasn't much of a response. So I think it is a lot of, the movement, but from movement to action, there is a big step. And I don't see that happening as fast as possibly it should.
So the system hasn't changed, but people's willingness to talk about these issues changed. From me, there was no one, when I arrived, there was no one willing to talk. And a month after, they were much more open, and much more open than many people because I've worked in many different countries, and Chileans were the ones who were the most vocal and clear about the political economic system as a problem in all of those discussions. So it doesn't mean that overnight the companies changed, etc. And there was a discussion about the reform of your constitution. It didn't pass, and I know it's still under discussion. But at least that discussion happened, and was much more open than in many other countries.
Other questions? No. Thank you.
Thank you.
Thank you again.